We have conducted thousands of consultations on mandibular advancement devices. We have summarized key criteria for selecting, fitting, and effectively using mandibular advancement devices based on our extensive experience. There are 3 key criteria for selecting mandibular advancement devices. For me, the most important factor is wearing comfort. After all, a mandibular advancement device is useless if it is too uncomfortable to wear. Regarding comfort, there is a fundamental distinction between one-piece and two-piece devices. One-piece mandibular advancement devices consist of a single block, usually cast as one unit. While production costs are low, they fixate the lower jaw, thereby preventing lateral movement of the temporomandibular joint. This often leads to temporomandibular joint pain. This is different with two-piece mandibular advancement devices. They consist of separate parts for the upper and lower jaw, thereby allowing for lateral movement of the temporomandibular joint. 2 factors determine comfort: material volume and pressure distribution. As a general rule, generally, the less material used, the higher the wearing comfort. Older models involve more material. Newer models regularly have significantly less material. Here is a comparison of models from the same manufacturer, but from different dates. Here the old model and here the new model. Pressure distribution also shows significant leaps between generations. The new model's internal structure ensures significantly better pressure distribution than its predecessor. The second selection criterion is jaw size. Here too, the following applies. An ill-fitting mandibular advancement device is useless. Industrially manufactured snoring devices are generally one-size-fits-all. However, this varies by manufacturer. There is a simple trick for this, though. Bite into a clean piece of cardboard and compare the imprint's dimensions with the mandibular advancement device's sizing chart. We have produced a separate video detailing exactly how this works, which I have linked here. With custom-made mandibular advancement devices, this problem does not arise, as they are fabricated specifically to fit the individual user. In return, the cost is considerably higher. I will address that shortly. The third selection criterion is the advancement setting, which is vital for the efficacy. The following applies. The greater the advancement, the more effective the device, but the higher the risk of discomfort. There is also a very clear difference between one-piece and two-piece mandibular advancement devices when it comes to the advancement adjustment. For one-piece devices, protrusion is set only during fitting. No subsequent adjustments are possible. In practice, this means that these devices can only be adjusted very roughly and imprecisely. Precise calibration is usually necessary to achieve the optimal balance between comfort and effectiveness. And that is exactly what two-piece mandibular advancement devices do. With these mandibular advancement devices, the upper and lower jaw pieces are fitted separately in individual steps. This allows the appliance to be adjusted subsequently. This provides significantly more flexibility, because the appliance can be adjusted without refitting, which is usually more precise as well. Regarding two-piece mandibular advancement devices, there are actually 2 distinct system types available: stepless adjustment using a screw mechanism, as seen here, and incremental adjustment, such as with spacers or straps. I believe that stepwise adjustment in 1 mm increments is sufficient. Stepless adjustment is not strictly necessary. It is important to ensure the advancement setting does not cause any pinching. This can be problematic for side sleepers when using spacers attached to the side. If you keep these 3 things in mind, you'll make the right call when choosing your mandibular advancement device. We know from extensive customer feedback that mandibular advancement devices are highly effective against snoring and obstructive sleep apnea. Clinical studies also demonstrate this. For instance, a study demonstrated that the use of a mandibular advancement device reduced snoring noise in 84% of patients. And not only that, mandibular advancement devices can also effectively combat snoring accompanied by breathing pauses. A large comparative study showed that mandibular advancement devices reduced the number of breathing interruptions by more than half in around 75% of the cases examined. Now comes a crucial point. Not every snorer is the same. A mandibular advancement device works best for so-called tongue-based snorers. These are people for whom the falling back of the tongue is the main cause. Mandibular advancement devices advance the lower jaw and tongue base, keeping airways open. However, mandibular advancement devices may be less effective for nasal or mouth-only snoring. That said, it can also help in this case because it reduces mouth breathing and encourages healthy nose breathing. When should you avoid using a mandibular advancement device? Well, that depends entirely on the condition of your teeth. There are two handy rules of thumb for that. There should be at least 10 healthy teeth present in both the upper and lower jaws. That means a total of at least 20 healthy teeth. Their distribution should be as follows. There should be 5 healthy teeth on both the left and right sides of the upper jaw, as well as 5 healthy teeth on both the left and right sides of the lower jaw. If these rules of thumb are not met, you should definitely speak with your treating dentist before using a mandibular advancement device. By the way, bridges, crowns, or implants do not prevent you from using mandibular advancement devices, provided they are firmly anchored and in good condition. Other contraindications to mandibular advancement devices are loose teeth, especially incisors, due to high protrusion pressure, jaw pain or temporomandibular joint disorders, braces, occlusal splints, or so-called aligners. As a rule, these appliances cannot be combined with a mandibular advancement device. Chronic asthma or epilepsy, as these conditions may lead to respiratory distress. In consultations, we occasionally receive complaints regarding typical side effects of mandibular advancement devices, such as tooth sensitivity. These do indeed occur occasionally, but the good news is that most side effects are only temporary and can be easily remedied. I will now address the 3 most common side effects reported to us by customers in our consulting practice. Do you have sensitive teeth? We recommend clenching the jaws or tapping the teeth 3 to 4 times upon waking. Does the jaw joint feel tense, or do you experience pain at the base of the ear? We recommend applying gentle backward pressure to the lower jaw with an open hand. This is generally a beneficial exercise to normalize the jaw in the morning after using the mandibular advancement device, that is, to return it to its normal state. Alternatively, you can chew on a piece of gum for a short time on either the right or left side of your jaw. A third occasionally reported side effect is excessive salivation. This is sometimes a problem initially, but it generally resolves itself. It can help to temporarily reduce the advance of the mandibular advancement device. How much do mandibular advancement devices cost? Prices for decent prefabricated mandibular advancement devices range from £50 to approximately £130 for premium models. Custom-made mandibular advancement devices typically cost between £800 and £1,400. In the case of simple snoring, i.e. snoring without breathing interruptions, snoring is generally not reimbursed by health insurance companies, because snoring without breathing interruptions is not considered an illness. For diagnosed sleep apnea, custom-made devices are available on the NHS, provided you meet certain clinical and dental criteria.
Ich habe hierzu bereits ein ausführliches Video gemacht, das habe ich dir in der Videobeschreibung verlinkt.
Clean the mandibular advancement device with mild soap and lukewarm water. Alternatively, clean the mandibular advancement device in a cup of mouthwash using a toothbrush. Remove the device from the liquid within 1 minute and rinse with clear water. For optimal cleaning, use specialized cleaning tablets or gels. Important: never use toothpaste or standard denture cleaners for cleaning. The ingredients may damage the surface of the mandibular advancement device. I hope this video provided a clear overview of mandibular advancement devices. Please post any questions in the comments. I will be happy to answer them. Until next time.